Welcome to the Navigating My Crazy podcast. I'm Shayla. Navigating My Crazy is a weekly podcast created for moms trying to balance life, family, purpose, and wanting to improve their mental wellness. Our goal is to inspire conversations necessary to end the stigma associated with mental health and the unrealistic societal expectations related to being a mom. But most importantly, to create a community so that no mom ever feels alone as we all navigate this crazy thing called life together. Let's start this show. Welcome to another episode of the Navigating My Crazy podcast. I am Shayla, and today we will be getting some pregnancy pearls from my mom guest, Dr. Nicole Plenty. So if you are expecting, planning a pregnancy, or have a loved one who is pregnant, tune in and make sure that you share this episode. We will jump right in after hearing from our sponsor. Is there something interfering with your happiness or preventing you from achieving your goals? I've shared on many occasions how my own depression and anxiety held me back for so many years, but not any longer. BetterHelp wants you to start living a happier life today. What is BetterHelp? Professional counseling done securely online with your own licensed professional therapist. It's more affordable than traditional offline counseling, and financial aid is available. Visit betterhelp.com/navigating. That's BetterHelp, H-E-L-P, and join the over 1 million people who have taken charge of their mental health. This podcast is sponsored by BetterHelp, and Navigating My Crazy listeners get 10% off their first month at betterhelp.com/navigating. Use promo code navigating at checkout. Now back to the show. Okay, welcome back. Now let me introduce you to Dr. Plenty. Dr. Nicole Lee Plenty is a double board certified OB/GYN and maternal fetal medicine specialist, a blogger, public speaker, and so importantly, a patient advocate. She was raised right here in Louisiana, DeRidder to be exact, and she attended Xavier University of Louisiana, where she held the title of Miss Xavier University and graduated with a Bachelor's of Science in Biology with honors. She then obtained a dual medical doctorate degree and Master of Public Health with a concentration in health systems management from Tulane University. Dr. Plenty completed her OB/GYN residency training as well as maternal fetal medicine fellowship at the University of Mississippi Medical Center, where she also earned a Master of Science degree. She is passionate about mentorship for youth from low-income communities and advocate for health and work equity for women of colors. Because of her passion to increase awareness of public policy directly shaping women's health outcomes, she served as a state and national leader in various sections of American Medical Association and American College of Obstetrician and Gynecologists. She is one of 2 recipients of the ACLG's fellowship, which granted her the opportunity to continue women's health advocacy work on Capitol Hill. Her passion for service is evident through her international advocacy and medical mission work in Nicaragua, Mexico, and Jamaica. Now, in addition to all this, she still makes time to be the proud wife of Reverend Dr. James Anthony Plenty and a mom to their son Harrison and fur baby Sophie. She provides high-risk pregnancy care full-time in Houston. And let me not forget her amazing podcast, Pregnancy Pearls with Dr. Plenty. So thank you so much for the absolute honor of joining me today.
Thank you so much, Shayla, for having me. It's funny, and you probably get this when you're on other people's podcasts. When they're reading your bio, you like, that's me?
Right, I did all that. So I do want to start off and ask you, what made you decide to become a doctor? Because I've heard you talk about initially wanting to be a lawyer.
Yeah, I did mock trial. I know you and I briefly talked about Toastmasters. I did Toastmasters before, and I just love like policy, politics, public speaking, and things like that. But I just don't like having to choose my words like that.
Right.
Like being an attorney, you are paid to know the right words, and
Yes.
I did not want to be that person that stays up all night just picking a word.
Right.
Then I went and did the National Youth Leadership Forum on Medicine. And I met other people that were aspiring to be doctors. Obviously, this was something to expose us to medicine, and I just loved it. So I did a pivot, and I decided, hey, I want to be a doctor. And then once it came to the type of doctor, I was automatically drawn to women's health, but I had a cousin that passed away from complications of pregnancy, which made me want to do more research on different pregnancy complications. And the rest is history. So I decided to go full-fledged into doing OBGYN and maternal fetal medicine.
Right, that's amazing. And speaking of that, my sister and I recently watched this documentary. This documentary by Soledad O'Brien about the dire state of Black maternity in Mississippi. And since you're from Louisiana, you know that we are ranked really high in the U.S. for maternal deaths. And of those deaths, 70% of them are moms of color. So, why do you think in this day and age where we can clone people, are we still seeing this staggering number of deaths in moms?
It's so funny that you say we can clone people. And until you said that, I didn't even realize, like, man, medicine is so advanced that we are doing IVF and making babies outside and implanting them in the uterus. And we are developing things to treat cancers, but we still can't keep Black women safe. So I did watch that documentary by Soledad O'Brien. I thought it was intriguing because, I trained at the University of Mississippi Medical Center. And so I was there for 7 years. And so some of the things that they were talking about, even some of the people that were in it, I was like, wow, that was during my time there. Or I remember, hearing about that, or I remember this patient transferring to us.
Wow.
It hit home on a lot of levels. Mississippi is, I like the training there because people don't have access to care. You have Jackson, Mississippi being the
Mm-hmm.
biggest city in the state and the only university in the state and the only trauma center or level 4
Right.
hospital in the state. So you got to travel like eons and eons to get to where you need to go to see some
Yes.
specialist. Well, that creates a problem because you can't get to anybody that can help you. So I think some of that with Mississippi is that Mississippi has so many rural areas. Even getting to a general OBGYN can be hard. And so if you have a complication, then you're literally helicoptered in or put in an ambulance and drove in urgently. So I think access has a lot to do with it, but we can't deny, even with the documentary stating the racism that exists in medicine is a real thing. I think it's funny, especially with me being so involved within the AMA, that this year or 2020, literally, we just decided that racism within the healthcare system or systemic racism as a public health crisis is just a new thing, right?
Wow.
And it's
Mm-hmm.
funny that we even had to debate. I mean, we were at the conference debating whether racism, systemic racism, was a public health crisis. And there are doctors that believe that no other doctors are racist. And my thing is, even the thought of that says that you're racist. Because if you're so naive to think that something else is causing us to die at alarmingly higher rates than everybody else, like we are just so negligent
Right.
that we are going to not take care of ourselves and we must be doing something wrong and it can't be anything in the system, then that by itself is a racist statement. So
Right.
I do think that that has a lot to do with it. And I hate to say that because I'm glad I got the education that I got and the training that I got from the University of Mississippi, but it was blatant. And even being a doctor there, it's blatant for us. I mean, we experience it too. So when people say, well, I don't know what they're talking about, I'm like, that's because you're not the person going through it.
Right.
And if you're the
Absolutely.
person going through it, you can feel in your heart when somebody is treating you differently than your Caucasian counterparts. And yes, that kind of stuff happens in Mississippi.
Absolutely. Absolutely. I'm so glad you said that. Because I believe on the documentary, one of the women was a doctor. And still a lot of her concerns were not being um listened to. So I know a lot what you say on your podcast a lot is all doctors are not created equal. And so with that statement, what should a mom do if she feels that she is not being heard by her doctor?
So let me go back to that statement, Shayla, because I know that especially my producer, and he puts it in my intro.
Mm-hmm.
All
I
doctors
love it.
are created equal. And it's not a jab to doctors, right? Because I know a lot of good doctors, but
Mm-hmm.
realistically, when you have a system in place where doctors are timed, literally timed with seeing you. And so it's not incentivized for us to take time with patients. It's just not. And if you're a general OBGYN and you're getting a global fee, so they're getting paid one lump sum to do all your prenatal visits plus your deliveries, and their office manager is saying they have 15-minute appointments. Well, you got to be cut to the chase when
Right.
you go to your doctor. As a maternal fetal medicine specialist, I have a little bit more luxury of spending more time because I can, by nature, I see high risk patients. And of course, I'm going to spend more time and we bill based on time, unlike an OBGYN that's getting
Mm-hmm.
a global fee. So I say the first thing you should do is make sure you come with your questions. I tell my patients all the time when they start their pregnancy, I need you to have a pregnancy notebook, not that cute pregnancy journal,
Mm-hmm.
but a notebook. Okay. I don't care if it's like a black and white notebook. I don't care if it's a spiral notebook. I don't care what it looks like.
Right.
But it needs to be something that you can keep all your stuff together and you need to carry it around. And then you need to take notes, right? I want you to take notes and I want you to know every single thing that you're being told that is not standard. So if somebody tells you something is wrong with your ultrasound, know what it is. Write it down and ask them, can you repeat yourself so that I can write that down? Or ask them to write it down so you know anything that's not standard. So if they're telling you that anything needs further follow-up, you shouldn't go to another specialist and not know what the follow-up is.
Right.
Or you shouldn't go to somebody like me and not know why you're going. But I
Right.
have so many people, Shayla, that come in, they have no idea why they're coming to see me. And sometimes I don't know either because it's not on the referral. So then we're sitting there trying to figure out what's
Wow.
really going on, or if there's something more than just an ultrasound they need to be seen for. So I would definitely tell your listeners, open your mouth, tell people what you're feeling. Even if you don't know how to describe something, you just tell them you don't feel right.
Mm-hmm.
Okay. And then you try to tell them why you don't feel right. And then write everything down that's going on with you. Write your questions down you may have at home. Email your OBGYN and ask them these questions. If you don't hear anything back from them, give them a call. Okay. Email etiquette is 48 hours.
Mm-hmm.
You give them 48 hours. If it's something urgent, like you're in pain, you're bleeding, your water breaks, then you call immediately. You don't email, you call immediately, or you go in to the hospital so that you can be evaluated. So the notebook, Shayla, making
Mm-hmm.
sure you say stuff, email and reach out, call if you don't hear anything back, and be persistent. You know what's going on with your body. We don't know what's going on with your body. So you have to be persistent. If something doesn't feel right,
Right.
you have to tell them it doesn't feel right. Now, pregnancy is not the most benign condition. Like, you're not going to feel fantastic during pregnancy. But
Absolutely.
if you are in pain, or if you don't feel your baby moving, or if there's a concern, then somebody needs to tell you why your concern is normal. Okay. Don't ever chalk it up to it's normal. Let them tell you it's normal.
Right. Right. And I think that goes back to a lot of times, just say for myself, I had my first son when I was 18. So I was pregnant when I was 17. So a lot of things you don't know or you've heard and you're not sure. So like you said, you think it's natural or you think it's a part of it. But I really love the whole write it down and go to the doctor's appointment prepared and not going, just kind of winging it based off what the doctor is saying. So yeah, those are great points. Um, so I know the last episode that you put out, it was mainly about being pregnant over 35 and beyond. But one of the things that you mentioned was about COVID-19. So what are some issues that you've seen women that want to get pregnant, or pregnant women with the effects of COVID?
So COVID-19 is such a weird beast because it can do so many things. So yes, it causes upper respiratory infection and pneumonia, usually is how COVID-19 presents, but it can cause some vascular damage. So it can cause you to have issues with other organs other than the lungs. So I've seen people that have present with chest pain, have a heart attack in pregnancy with COVID-19. People can have blood clots in their legs with COVID-19. And if you have a blood clot in your leg, you can get pulmonary emboli or blood clots in your lung. That can be detrimental and even cause you to die. Um, Usually, some people get issues with their kidneys from COVID-19. So, from a maternal standpoint, mostly the lungs, but second most common, definitely blood clotting and kidney issues. The baby can also get COVID-19. So, we now know that COVID can cross the placenta. We didn't know that a year ago.
Wow.
So now we know COVID can cross the placenta. If you have COVID-19, your baby has about a 3 to 5% chance of also getting COVID-19. That puts you at increased risk of having a stillbirth. We've had people that present completely asymptomatic, have a stillbirth. We COVID test them, they're COVID positive. The baby's
Wow.
COVID positive.
Mm-hmm.
Some of those babies, even if you don't have a stillbirth, can tend to be smaller. So if you get COVID-19, you'll be sent to somebody like me and we'll follow the growth of the baby throughout the pregnancy, usually once a month. The placenta can be really, really big and globular on ultrasound, and the blood flow from the placenta through the umbilical cord can be diminished. And so we usually see that in conjunction with a smaller baby. And then rarely, but still present, you can see little strokes in babies' brains. So sometimes we see that before, sometimes after a baby delivers, they have a normal brain scan. And then a couple weeks later, they scan them again and we can see evidence of like little microhemorrhaging there, or what's called interventricular hemorrhage, which is just a stroke in a child. And of course, that can cause some long-term cognitive delays. Babies
Mm-hmm.
having stroke, just like we have stroke.
Right.
It can cause some cognitive deficits and some motor deficits as well. So you don't want to get COVID-19. Now, if you happen to have had COVID-19, breathe a second. We're not telling you your baby's going to die.
Right.
We're telling you that you need to be monitored closely so that we know exactly when to intervene. Okay. We will look on ultrasound and make sure that we don't see any signs of COVID-19, like a small baby or like anything in the brain. And then your baby will be evaluated. Even if it was way in the first trimester, your baby will be
Mm-hmm.
evaluated after you deliver to make sure that your baby is healthy. And like I say, that risk is 3 to 5%. So more than likely, your baby will not be affected. But if you have not had COVID-19, don't even take the risk. Make sure you're wearing your mask, make sure you're washing your hands. If you get vaccinated, that's a good thing. Of course, the Pfizer and Moderna vaccines are the two-step vaccines, and they are 94 and 95 or 95% with Pfizer and 94% with Moderna effective. The Johnson and Johnson is now off. It's only about 65% effective, but it's 85% effective for severe disease.
Mm-hmm.
So it is safe in pregnancy. All three of them are safe in
Yes, that's what
pregnancy.
I was about to ask. Mm-hmm.
Yeah, they're safe in pregnancy. And now we know from some cases of babies that are born after moms get vaccinated, we have seen that, hey, those babies have antibodies, at least to the Pfizer Moderna vaccines. So that's a good thing. That's
Mm-hmm.
the reason that you get the Tdap vaccine in pregnancy at 28 weeks, is to give the baby immunity against whooping cough. Same thing for this. We're seeing that those babies now have antibodies against COVID-19, which is a good finding.
Right, that's encouraging. That's very encouraging. And I saw you taking your vaccine.
Yep. I got
um,
vaccinated as soon as I could. I was like, when can I get
yes.
vaccinated?
And as a provider, that is important, that you feel safe, and then that you feel safe, working with your patients. So that's awesome. Um, So my next question, and this is a personal question, just because there's so many myths with stretch marks,
Mhm.
as far as how they happen, if they have to happen. Because one of the reasons I've been told that I have stretch marks is because I was scratching, and I'm pretty sure this is the reason why my daughter never wants to have kids, is because she doesn't want to have stretch marks. So is it like preventable? Is it just something that's hereditary and more than likely it's going to be passed down? What do you think? And
It's
can I buy this $100 cream to make it go away?
it's not necessarily hereditary, right?
Mm-hmm.
It happens because of sheer mechanics. Your abdomen is stretching to keep up with the growing uterus. And then once your uterus is empty after the baby is out, your abdomen tries to go back down to its normal size because there's nothing stretching it
Mm-hmm.
out. And because of that, once you have that collapse of the skin, you can see some stretch marks or the darkening areas on your belly. Some people have it on their upper thighs as well if you had some weight gain and then you lost weight after your delivery. I actually talked about this on my episode Skin. I
Mm-hmm.
brought a dermatologist in, and honestly, I brought her in for my own selfish reasons because I too wanted to know. Um,
Uh-huh.
so it's not something that can be prevented. You can decrease the appearance of them. And the best thing to try to stop them from happening altogether is keep your skin hydrated, right? So if you're keeping your skin hydrated and moisturized, we have seen that those people have less appearance of stretch marks, okay? After you get them, though, there's not like a quick fix to
Mm-hmm.
get rid of them. The dermatologist I had on my show talked about doing some dermabrasion and micro needling to lessen the effects of them and to lighten them. That can be done. And so you do have some cosmetic procedures that you can do to lighten the appearance of them. You do have some skincare creams. So bio oil is good. Of course, old fashioned cocoa butter is good.
Right.
And then you have creams by Melee that those are good. But anything that can keep your skin moisturized for a long period of time is what you're going to need to try to stop you from getting them from jump. And then I like bio oil and I like Aveeno to keep your skin moisturized afterwards. But unfortunately, it is a war wound. Okay,
It is.
when you think of it, pregnant women, the body is so amazing what it can do. And
Absolutely.
women are just so beautiful in that we can carry and create this work of nature. So I always tell people, you're not going to care about your stretch marks once you have that baby there.
Right.
You look at that baby and you don't even care because it's all worth it. But
Mm-hmm.
yes, sure that you are moisturizing will help, but it may not necessarily prevent or get rid of
Right.
stretch marks.
Right. That's
I
a
do
good
not agree
answer.
with buying your $100 skincare. If you're gonna pay $100 for a skincare cream, you may as well go to the dermatologist and get your
Mm-hmm.
microdermabrasion and and decrease your appearance professionally. Somebody
Right.
that has some guarantee behind that, other than buying like just really expensive over the counter creams.
Absolutely. Wish you would have told me that about $7,000 ago.
Oh
No,
no!
no, this has been like over years, of course, because like I said, I had my first son when I was 18. And I did because I was so small and I just scratched and scratched. It was awful. So I just don't want to focus, of course, on the complications of pregnancy. Don't want to scare anyone because, like you said, pregnancy is a beautiful thing. So what are things that you recommend for women that are preparing to be pregnant or want to have babies? How can they prepare their bodies for pregnancy?
Well, first of all, I think that everybody needs a preconception visit. And that is somebody that's really going to give you more than just like a general overview of what you need, but looks at all your situations, look at your medical problems to try to make sure they're optimized and the timing is right. Preconception care and making sure you're healthy as possible before your pregnancy is the number one thing to prevent you from having complications during pregnancy. But what you can do if you're like, no, Dr. Plenty, I'm ready right now, is if you have diabetes, make sure your hemoglobin A1C is at 6%. That is crucial.
Mm-hmm.
Okay, you do not want to go into that thing with a hemoglobin A1C of 8 because we know that those babies have a much higher risk of heart defects. So making sure that your diabetes are under control. If you have high blood pressure, make sure you're evaluating the medications that you're on to make sure they're safe in pregnancy. If you're on ACE inhibitors like lisinopril, anything that ends in pril, you should not be on that during pregnancy.
Mm-hmm.
You need to come off of that. So talking to your doctor about what medicines are safe in pregnancy versus not is key. Also, if you are taking creams that have retinoic acid in them, you need to stop them.
Mm-hmm.
to not do any retinoic acid pills or cream for about 2 months before you get pregnant. Retinoic acid can cause a big issue with cleft lip, cleft palate, issues with baby's kidneys, issues with the heart. So you need to come off of those. And then if you do have the luxury of waiting a little bit, if you are overweight or obese, even losing as much as 10 pounds can help you reduce your risk of things like preeclampsia in the pregnancy. So I always tell people, start a daily exercise regimen before you get pregnant to try to, one, boost your energy, and two, that helps with ovulation, and three, that helps you get down to a healthier weight. It helps regulate your hormones better, so that when you're pregnant, you can have a lower risk of preeclampsia.
Okay, that's good. And so the visit, should they schedule this visit with a OB?
No, I mean, they can schedule it with their OBGYN or a maternal fetal medicine specialist or even their primary care provider.
Mm-hmm.
So it's whoever feels comfortable talking to you about pregnancy. So
Mm-hmm.
it doesn't have to be an OB. If you feel comfortable talking to your primary care provider, and some people's family medicine doctors do deliveries.
Right.
So if that's a person that feels comfortable talking about pregnancy, then you can go to them. But it just needs to be somebody that's knowledgeable about pregnancy and is willing to go through your medical history with you.
Mm-hmm. And so
And your
one,
husband's medical history. Like, let's not forget the men.
oh, that's
So you
good.
can find out a whole bunch of stuff after you having a baby with somebody, and you don't think about what they
Mm-hmm.
have in their family. So sit down and talk to your mate to figure out what's going on in their family, because that's what's going to that's 50% of the genetics
Right,
of the
that's
child.
true. That's absolutely true. Yeah, my mom always says something about my kids. Yeah, they got that from the dad side of the family. Whenever something's wrong with them, they got that from the dad side of the family.
That is hilarious.
All right. So one of the things you just brought up was preeclampsia, and that's something that I've been hearing more lately, and I've never honestly heard it before these last maybe 3 years. And I think maybe more because of celebrities have had these issues that we hear about it more. But why should women of color familiarize themselves with this condition? And is it preventable or treatable?
So preeclampsia is the real deal. I mean, like I said before, one of the reasons, the main reason, the only reason I went into maternal fetal medicine was because my cousin passed away of complications during her pregnancy. She had preeclampsia, and preeclampsia is when you have high blood pressure and vascular damage. Your doctor is going to look for that vascular damage as protein in your urine.
Mm-hmm.
And even if you have no medical problems, you can still get preeclampsia. So that's why it's such a big deal, because you think you're healthy. Even people that work out all the time, like Serena Williams, is like
Mm-hmm.
extra healthy, but
Right.
she had a blood clot and she had preeclampsia. So you can be super healthy and still get preeclampsia. So black and brown women need to familiarize themselves with it, because our rates of preeclampsia are super high.
Mm-hmm.
About 3 to 8% of all pregnancies have preeclampsia. But when you look at Black women, we're 7 times more likely to have it. So
Absolutely.
if we're more likely to have these conditions, then we need to know the warning signs of it so that we can prevent further complications of the preeclampsia. If you're over age 35, if you're Black, if you have an autoimmune condition, if you're having an IVF pregnancy, if you have diabetes, if you have high blood pressure, you should be on a baby aspirin to help reduce your risk of preeclampsia. Okay. That helps reduce your risk of preeclampsia by about 15%, depending on when exactly you started. And we want you to start it before the 16th week. So optimally 12 weeks. It does have some benefits shown up to about 26 weeks, but we want you to start it as early as possible. Why? Because the placenta is starting to develop at around 12 weeks. Before that, you have that little yolk sac that's in there, just a little bubble in the on the ultrasound, right? Within the gestational sac with the little pole with the little flicker.
Mm-hmm. Mm-hmm.
Well, 12 weeks is when we start having a placenta, and then that yolk sac starts to disappear. The invasion of those vessels and embedding into the uterine wall can be constricted, and there are certain hormones that can be released. Now, we don't even know all the hormones that were released, but we know that some of those hormones can cause there to be constriction at the level of the placenta and have been found to contribute to preeclampsia. Low dose aspirin, or aspirin 81 milligrams, is going to block the production of some
Mm-hmm.
of those hormones that cause constriction. Well, if you started late, when the placenta is already formed, well, you're not going to get the maximum benefit from the aspirin. So that's why I tell people 12 weeks, that's the optimal time to start that. to reduce your risk. Besides your baby aspirin, there's nothing we can do to give you to reduce your risk. Everything else is up to you to try to reduce your risk. And that is optimizing all the other stuff that could put you at increased risk. If you have thyroid disease, make sure your thyroid is controlled. If you have high blood pressure, make sure your blood pressure is on point before you get pregnant. So optimizing your health conditions before pregnancy, plus taking a baby aspirin in the beginning of your pregnancy, can reduce your risk of preeclampsia. But even with that, Shayla, some people still develop it. So we have to know the warning signs. So if you are in your late second, early third trimester and you have a headache, you take 1,000 milligrams of Tylenol. Some people don't like take medicine, Shayla. And I asked them, have you taken Tylenol? Well, no, I don't want to take any medicine. I'm just going to deal with my headache. This is not the time to deal with your
Right, because that shoots your blood pressure up, all kind of stuff.
We want you to treat your headache because that tells us whether or not you have preeclampsia or not. If you have a headache that doesn't go away, then we know that that needs to be worked up. Because the first thing we're going to do if you don't take medicine at home is we're going to give you that expensive Tylenol when you come to the hospital. That Tylenol, you could have bought it.
Yes. And I think that's the myth also, because women just assume you can't take medicine if you're pregnant. I remember hearing that when I was pregnant, like you just got to thug it out if something's wrong. So I think that has a lot to do with it also.
Well, some of that is if you have any question, then you need to talk to your OBGYN, or you can send me a DM. You can send me a DM. I'll let you know. Because there are certain medicines that are not safe, like Motrin is the same thing as ibuprofen. After the 32nd week, you shouldn't take that. That can cause some issues with the baby's heart and can cause some issues with the baby's kidneys. Now, people don't remember usually what that gestational age is. They don't remember the 32 weeks. So we just tell you not to take it at all, to not confuse you. Okay. So there are certain meds you shouldn't take. But Tylenol is one that is safe to take. It's one of the only meds you can take for pain or headache or fever in pregnancy and be okay. And when you take it, we want you to take 1,000 milligrams. We want you to take 2 extra strength Tylenol. We're not playing with this thing. You got a headache? We want you to knock it out.
Knock it out.
Right. And if your headache doesn't go away, then you need to go in. Okay. And anytime you have a headache, that should prompt you to take your blood pressure at home. Every pregnant woman should have access to a blood pressure cuff. I'm a big believer in that. You need to know, as Black and brown women, we need to know when we're having high blood pressure. So order one from Amazon, take your blood pressure if you have a headache. And if it's high, then you need to go in. Headache, blurry vision, and pain on the upper right side of your belly over your liver. Those are the symptoms of preeclampsia.
Okay, that's good. And so does it automatically disappear after the mom has the baby, or are there still like repercussions?
There's still a risk. So we know that the cure for preeclampsia is delivery because we know the placenta is causing the hormones that cause preeclampsia. And you can't get rid of preeclampsia without getting rid of the placenta. You can't get rid of placenta without delivering the baby. So we know the cure is delivery. For people that get preeclampsia early, if we can control their blood pressures, then we can try to keep them pregnant longer until at least the 34th week. And then they would need to be delivered if they have severe preeclampsia. If we can't control their blood pressures or they have any lab abnormalities, then that could be a reason for your OBGYN to need to deliver you before that time. A lot of people kick and scream because they don't want to be delivered. That by itself can cause people to pass away. Because preeclampsia, if you're not controlled, all of a sudden you're having a stroke. So always get a second opinion if you need to be delivered early, but you do need to take it seriously and not think, I'm just going to stay pregnant for my baby. Now, after you deliver, you're not off the hook. You need to go back in 7 days after you deliver to get your blood pressure checked. Every single patient that has preeclampsia should be seen 7 days after delivery. Okay. And then if that 7 days falls on a weekend, they'll tell you to come in on Monday, or they'll tell you to come in the day before. If you, once you get to the 6 weeks postpartum course period, you should be home free. So at that point, it's not preeclampsia if you have high blood pressure, but you can still get, even if you didn't have preeclampsia in the pregnancy, you can still be at risk for preeclampsia up to 6 weeks afterwards. So pay attention to a headache that doesn't go away, or blurry vision, or pain. All of a sudden you have a whole bunch of swelling a couple weeks afterwards. Well, after 2 weeks, your swelling should be gone. So if you have new onset swelling or pain in your belly, blurry vision, or a headache, check your blood pressure, see if it's high. If you have high blood pressure, it always requires more workup.
Oh, that's good. That's really, really good. Because I just from the things that I've been reading and hearing about moms that have been that we've lost after the fact of the baby. Though those were the symptoms that they were experiencing. And another
Things
thing is understanding who, and because I think it was the communication issue, because they
like
were going to the emergency room, and so that information wasn't being translated to their actual doctor, as far as, because they would say follow up with it, but the communication wasn't happening.
I've seen that happen so many times, Shayla. Our ER doctors do a great job with traumas, right? In emergencies and very life-threatening things. But if you come in postpartum, and one, if they don't know you're postpartum, they may not be thinking preeclampsia. And so that's why I tell my patients, if you got an issue in that 6 weeks postpartum period, you call me.
Right.
I want to know that you go to the ER. And anybody that is in that first couple weeks, especially, and you go to the ER with anything, your OB should be seeing you, or somebody in that group should be seeing you. That deserves a postpartum evaluation, because our ER doctors are great, but they're not thinking about all the other things that could happen just because of a pregnancy. I've had so many people that told me, oh, the ER doctor told me I had pneumonia. What caused you to have pneumonia, girl? Like, why do you
Right.
think, been in the hospital, what makes you think this is pneumonia?
Yes.
That's not. It's fluid and congestion in the lungs from probably pulmonary edema associated with preeclampsia.
Right.
So that is the importance of not going to the OB. You need to go to the person that actually delivered you, or somebody that is an obstetrician or has some type of expertise in that field, so that they can screen you and make sure that you're okay and it's not chalked up to pneumonia and you're given antibiotics to treat what?
I've heard that. Like when you said that, like I know at least 5 people that have gotten that diagnosis after being pregnant, going to the emergency room.
It's not pneumonia.
Mm-hmm.
It's not pneumonia. You didn't just all of a sudden get
Right.
pneumonia. Nobody else in your house is sick, and all of a sudden you have pneumonia. No,
Yes.
it's probably fluid. And eventually, the good thing is most people, it does go away, right?
Mm-hmm.
Over time, it goes away. Thank God.
Mm-hmm.
But for some, I mean, all of a sudden you come back with an after having a eclamptic seizure, because nobody realized that this was not,
Yes.
you know,
Yes. Yes.
pneumonia.
Because the old folks say your pores still open. That's why you. Yes. Yes. I've heard that before. Mm-hmm. Oh, thanks for sharing that. That's really good information. Really good. Yeah, I'm gonna share it with a lot of people that I
Yeah,
know.
I mean, the whole reason, like my cousin that passed away from complications of preeclampsia, she went in and was told that she had pneumonia. She was still pregnant. No fever, no nothing. Mild range blood pressure, told she had pneumonia, and she was sent home. 2 days later, she's seizing. She's
Wow.
helicoptered to Baton Rouge, and
Mm-hmm.
then they sent her to New Orleans because she had an eclamptic seizure and developed acute respiratory distress syndrome and was intubated. Now, after she was intubated, she got ventilator associated pneumonia,
Mm-hmm.
but then she never made it out. 23 years old, healthy. I always think, and you can't think the what ifs, but now that
Mm-hmm.
I'm a high risk specialist, I always sit there and like, what would have happened if
Yes.
she didn't get sent home 2 days before she had the
Right.
seizure,
Mm-hmm.
right? If she was in the hospital on magnesium to
Mm-hmm.
prevent that seizure, to
And
try to
somebody
keep,
recognized it. Yes.
yeah, yeah, it's amazing the things that can be prevented. And now we know that our data in Texas tells us that 85% of maternal deaths could have been prevented. 85%
Wow.
could have been prevented.
Wow.
And when you think about that, it's just horrific, because let's say if she were anybody else, if she was not a low income 23-year-old, from this super rural area, would she have been taken more seriously, or would something been done further to evaluate why is her blood pressure high? Like, what explains a mild range blood pressure in somebody who's 23 with no
Right.
history of high blood pressure?
Right.
But they're not thinking that. They're like, oh, well, she has some fluid in her lungs and she has pneumonia. Let's give her some antibiotics and send her home.
Mm-hmm.
Spray
And
them.
one of the things you said on one of your podcasts, it was just a comparison to women of color to our counterparts, is that they treat doctors as if they work for them, whereas we are more looking at them like the expert, and we're going to them and they're doing us a favor. And I think that was right on point, the way that we look at doctors. And so we don't question, or if we don't understand, we don't speak up and say we understand, because we just think it's doctor language and it went over our head. But that was a really great point. I'm telling everybody, if you're a woman, if you have somebody pregnant in your family, if you're pregnant, you want to be pregnant, you have to listen to Dr. Plenty's podcast. It has so much amazing information that she shares
Thank you so much,
on
Megan.
that podcast. So what made you start the podcast?
Because of that.
Mm-hmm.
I mean, I was a director in Indianapolis, Indiana, and when I came to Houston, a lot of people would still contact me, would email me and ask me questions, or wanted some follow up, and I noticed that people asking me the same questions. So then I started the YouTube channel, which is youtube.com/pregnancy pearls with Dr. Plenty. And I just put together like questions that people would ask, or if somebody asked me about a topic, I would do a video on the topic so that they can have it. And then the podcast actually came about because my friend who does another podcast with me called Oh That's Deep, Black Women Conversations, she actually does promotions for Radio One and TV One. And she was like, we've got to do a podcast for Pregnancy Pearls. And I was like, no, I just want to give people information and be helpful. And she was like, you can probably help so many other people if you do a podcast, because it has just a different type of audience. Yes. And podcasts tend to be longer than your YouTube videos, 10, 15 minutes. And she was like, you can give more in-depth information there. So I used it as a way to just reach more people. And because people are dying out here and people don't know what to ask, I feel, very much so, drawn to help people. I just feel like people do. I don't want to say that Black people don't, or even white people don't respect doctors. I think there is a level of respect that's there. But I do think it's different when I see a Caucasian person versus a white person. And I'll look at that person and I'll say, you have any questions? And the Black person, not all, but some, especially young people, like, I don't have any questions. I'm like, okay, tell me what you just heard me say.
Right.
I'll ask them, tell me what you just heard me say. And if they can't repeat it, I'll say, okay, Margarita, go give me a notebook. Here's your notebook. Yes. I want you to write everything down. But I know a lot of doctors are not going to do that. Like, if you say, you understand, they're walking you out the door because, like I say, they're on the clock. Okay. And so I started the podcast and the YouTube channel because I wanted people to know what to ask. And I wanted people to feel comfortable asking. I think some people don't ask questions because they think it may be a dumb question. So I wanted to make sure people understood, like, that's not a dumb question. Like, you ask these questions when you go to the doctor, and you need to act like this doctor works for you. Like, you are a part of my little pregnancy advisory team. Yes. You need to give me some answers. Your job is to make sure I get through this thing safely, because it is their job. Yes. Now, our Caucasian counterparts treat it as if it's our job. Like, they demand somebody to call them back. We don't call them back. It's 3 phone calls. I'm like, she just called like 10 minutes. Right. She's calling again, Dr. Plenty. I'm like, okay, well, let me tell this patient I'll be with her in a second. Let me call this person back. But we don't do that. I agree. We don't do that. And we need to start acting like we are the only patient. Okay. And your doctor should be treating you as if you are the only patient. Yes, I can see a Dr. Plenty pregnancy notebook with some questions in it that we give out to pregnant women, just putting that in the atmosphere. Well, thank you. Because that would be awesome. But I just want to thank you so much for your time. I know you are in between patients. So just tell my audience how they can find out more about you, what you're doing, and the amazing work that you have all over the world. Oh, well, thank you so much, Shayla, for having me. I really enjoyed my time today on the podcast. I'm definitely going to have to ask you to come on my podcast so we can talk talk
Yes.
shop and convince these conversations. But if you want to follow me, I am on Instagram at pregnancy_pearls, and I'm on Facebook at Pregnancy Pearls. Of course, the YouTube channel is just youtube.com/pregnancy pearls with Dr. Plenty. And then the podcast, you can find it pretty much anywhere. It's on
Yes.
Apple Podcasts, Spotify, and it's called Pregnancy Pearls Podcast. And that confuses people because they think it's going to be Pregnancy Pearls with Dr. Plenty, but it's not. It's just Pregnancy Pearls Podcast. So it's on iHeartRadio, Spotify, Apple Podcasts, Google Podcasts, Stitcher. You can probably find it anywhere.
Everywhere. Just type it in or go to her Instagram page and she has all the links and you can type it in there. I mean, just click the link and go there. So thank you again so much for your time. I appreciate you, and the information that you shared was amazing. So thank you.
Thank you so much.
All right. You have an amazing day.
Thanks, you too.
All right. Bye. Thank you.
Bye.
Thank you for listening to the Navigating My Crazy podcast. Don't forget to send all of your questions to questions@navigatingmycrazy.com, or you can complete the form on our website at navigatingmycrazy.com/contact. Also, join the community and chime in on the conversations by liking and following Navigating My Crazy on Instagram, Facebook, and Twitter. Subscribe and rate us 5 stars on iTunes or your favorite podcasting platform. Moms, have a great week and get ready for our next Talk It Out Tuesday.